Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, and today we have a bit of a unique episode. Because it's Red Ribbon Week, we wanted to have an episode that really highlights the importance of remaining drug-free and the importance of living a drug-free life. We actually have with us Zack Cooper. He's the executive director for Medisic, and they are a outpatient service that helps people get off of opiate drugs. They see a lot of different things, but they primarily focus on getting people free from opiates. And as we've seen with, even on TV, we've seen TV shows that really highlight how significant the opioid crisis has hit the United States. Unfortunately, it's something that still has not been managed well enough. It's still out of control. It's still affecting a lot of people. And because there's been such a crackdown on providers being able to provide opiates to patients are turning to the streets, and they're turning to street drug makers, which are using fentanyl in a lot of these medications or other kind of medications in a lot of these drugs that are making it worse for killing people, making the addiction 10 times worse. And it's organizations like these, Medisic, that are a group of physicians that have their heart in the right places and nurses that have their heart in the right place that are really trying to help patients get off of these drugs and have a better life. So today we talk with Zack Cooper, who's the executive director, and he tells us about the significance of the epidemic, what's actually going on. We did start the conversation, so this episode's unique in that it kind of jumps right beginning of the conversation, and then we talk more and more about what's going on, what they're doing about it, and what they see for the future, and even how we can be a part of the solution. So as always, thank you for listening to the Medical Sales Podcast. We do our best to bring you guests that are pioneering, trailblazing, really being innovation to the world of medicine. And I really do hope you enjoy this interview. All right, so Zack, talk to me. Where are you calling us from?
Greenville, South Carolina.
Greenville, South Carolina. How's the weather out there right now?
Sunny and a little chilly.
What's chilly?
I think it was like 24 degrees when I left this morning.
Oh, man. That's subhuman temperatures. We're 59 degrees and we're chilly over here. So I can't even imagine what that looks like for you. Man, that's intense. Okay. Wow. Do you guys get out or you just stay inside all day?
No, it's the sun's it's really sunny. So it's probably not that cold anymore. And usually the sun's pretty warm. I haven't been out much today. I usually start on my errands after lunchtime.
Got it. I can only imagine. And do you guys have to shovel snow and all that over there?
No, we might get one snow a year and it's usually melted within 2 or 3 days.
Got it. So not a big deal. Okay, cool. All right. So let's talk about it. First off, have you been on a podcast before?
I've never been on a podcast before.
So this is like a whole new thing for you.
Yeah. I mean, I listen to them every day, but never been a part of it.
Have you listened to ours?
I think I have, to be honest. I have a big playlist of kind of medical sales, medical information, news, innovation. So they just kind of play all day, every day. Some weeks I'm on the road for about 600-700 miles. So I listen to a lot.
Wow. So let's talk about it. Tell me a little bit about your organization and the role you play.
Okay. Well, Medisic started in 2020, right before COVID. The 3 founders are, one's an emergency medicine physician, 2 are critical care providers. Historically, most of my experience throughout my nursing journey has been in ICU. The 3 of them kind of got together one day and saw that the opioid pandemic is running rampant in South Carolina, the nation as well, and looked at ways to get ahead of it. By the time someone ends up in the ER, in the ICU, that's probably not a good sign if it's drug related, whether it be an overdose or complications from drug use. So they started our first clinic in Greer, South Carolina, which is a little east of Greenville. It's where the giant BMW plant is. That's kind of where most people know where Greer is. And now we are 6 offices across the upper half of the state, and we're working on one right now in North Carolina. The things we do is, anybody that may have an addiction to opiates, substance use disorder, opioid disorder is what it's classified as now. We see them on a weekly basis. We try to model our clinics just like a regular doctor's office, not like the old school kind of thing. When you hear a drug use clinic, you think of the long lines, the getting once a day dosing, open bright and early in the morning. We modeled our practice just like a regular doctor's office. People make their appointments. They come in during regular hours. Every week they meet with one of our providers. It's, hey, how's your week been? How's everything going? Everything going well? How's your medicine? And for medication, we use buprenorphine in a combo therapy or a single therapy. So the common names are Suboxone or Subutex. So that's what we use in most of our treatment plans. And we've had pretty decent success. I think just by running it as a normal doctor's office and making, the visits easy to attend, not starting at 5 a.m. and closing at noon. We accept all insurances that'll get credentialed with us, even Medicaid. I don't know of many other recovery places that will accept Medicaid other than the state ran ones. And as all state and federal ran organizations, they're very backed up.
Right.
We get people in within 24 hours. If they call in a crisis, our goal is to get them in the same day, if not, the very first thing the next morning.
Wow. In general, how many patients are you guys seeing?
Company-wide, in a week, we see over 600 patients.
Wow.
So about 100 patients a clinic right now.
Okay. And you're keeping close tabs on these patients. And this is just visits. So nothing's in-house. These patients, it's all outpatient, right? They come by, they get checked up, they get their medication, go on with their lives. Wow. Okay. What got you into this? If we go back to your career, you started off as a nurse. Has addiction been something you've always wanted to be a part of early on in your nursing career, or is it something you grew to love, or what happened?
To be honest, my nursing career, like I said, I was in ICU. After about 5-6 years in ICU, I just really got involved in community health and researching community-based health of, the strategies that were going on. A lot of things we would see in the ICU were very preventable things, congestive heart failure, flare-ups, COPD flare-ups, diabetic issues. Most of those things, a lot of the problems could have been solved with community-based care, either somebody getting access to their insulin, if it's affordable or not, or their diabetic treatment supplies, someone teaching a patient with congestive heart failure an appropriate diet and helping them afford healthier groceries, because we know that it's a lot cheaper to eat poorly. So I just got into that and I really didn't know where to start, where to fit in, what was going on. My first adventure into the outside hospital world was a senior living community. I thought it was a really cool concept of active seniors living together in one kind of neighborhood and a nurse being on staff just to check in with them. While I was there, I met kind of the hospice world, hospice sales, the ins and outs of hospice care. And then that's where I ended up for a little over 2 years. And then while I was working in hospice, one of the providers that founded Medisic reached out to me and said, hey, I've been telling you about the startup I've been working on. We're to a certain point, we need some help. Would you be willing to come on board? So that's where addiction itself is not what drove me to this, but it's just seeing a huge problem and need in our community and helping people. That's my passion. When you see kind of the communities around here, I grew up in a very rural small town that was based solely on a textile mill that doesn't exist anymore. Like I said, drug use is pretty high around here. So it's just finding a problem that's affecting my community and working 100% towards a solution.
That's awesome. So how long have you been working in the opioid space, opioid addiction?
I came on board about 1.5 years ago.
So, the opioid addiction, that's been around for a while. I remember back in my pharmaceutical sales rep days, I would see, and I'm talking maybe back, as far as 2009, maybe 2009, 2010, and I would see some primary care providers, they were giving opioids like the wind. Back then it wasn't frowned upon, and a lot of patients would just come and want more and more and more. And these providers would make a ton of money. So they became, they used to be called pill mills, where they would just be writing hydrocodone, oxycodone, like the wind. 30, 40 scripts a day. and they'd be profiting significantly from it. Then it kind of got out of control, right? And then ultimately people started dying from the opioid crisis, and then it blew back on the pharma companies, and then Suboxone came around, and we are where we are today. Would you say that we're in 2022 now, so a lot has happened since 2010? Would you say that the opioid crisis has gotten a pretty good handle on it? Is it still as rampant as it used to be, 10 years ago? How would you say it's changed in the last 10 years?
I don't think they're even close to having a handle on it, to be honest. So, like you said, 10 years ago, doctors were writing prescriptions and lots of them. They were helping, patients that may have been in pain to start with. And then it kind of got to a point where they just needed it to function. And then once they got really strict on doctors, yes, that did cut down on some of the prescriptions and the maybe not as needed prescriptions. But where did that leave all these thousands and thousands of people that kind of needed it to function on a day-to-day basis? Well, it just took away their supply to safe drugs, right? So now the issue you're seeing is street drugs. You used to could buy pain pills and stuff right off the street. Now you have no idea what you're getting. You might go to buy a Norco and it's fentanyl, or God knows what's mixed in that pill. That's one of the biggest issues right now is fentanyl. It's hard to get a handle on. As a farm rep, you probably know the half-life of fentanyl is longer. Sometimes, Narcan's a great drug. It can reverse stuff. And Narcan is very short-lived and short-acting in the system. So you give someone Narcan and it might wake them up for a minute. But if they've taken some type of very long-acting med that's been made in someone's basement, that med kind of reattaches. And that's the issues we're seeing now. And then kind of all the issues coming from unclean drug use. The opioid kind of resources and things were a shotgun blast from the government, with Suboxone, and everybody can get an X waiver. They just have to take the class. And I think that kind of, yes, it got the help out there, but then with a lot of providers, I feel like it just became a revenue stream versus anything else.
So meaning what? Because a revenue stream, meaning they're driving the Suboxone prescriptions, but why is that a bad thing?
Trying to think of how to say this. It's a lot of doctors I've heard they will only allow and see patients at a cash charge. They won't bill for it. It may just be you go in, you get a 30-day prescription, and you go into that doctor every month. You pay around here, it's the cash-based clinics are $250 to $300-ish a month. You go in, you pay that fee, you're given a 30-day supply of medications, and then that's it. With addiction comes with a lot of social factors, a lot of, psychological factors. Therapy and support is, just as important in treating an addiction as getting them safe medications. Suboxone can control the physical cravings, but it's not going to teach you support structures. It's not going to
give you that better day or that euphoria that you were getting,
right,
that hit of
right.
euphoria when you're managing your life's problems.
Right. And the way when I'm out in the community teaching and really pushing, the social factors is no one wakes up one day and just says, hey, I think I'm going to go take fentanyl. No one wakes up one morning and just says, hey, I'm going to go find some narcotics and take and just see what happens. It's just like drinking and smoking. You're out with some people. One of the 8 people may have a pack of cigarettes and say, hey, you want to try a cigarette? And everybody grabs one. You're like, yeah, sure. Why not? The same thing happens with opiate use. And if you don't help people learn, support systems and how to get away from unsafe crowds and bad influences, you can give them Suboxone all day long. But again, it's not going or the root cause.
Now, would you say that, the amount of people that have opioid addiction, is it from the original boon of opiates from providers, or is it all from the street use and a situation like what you just mentioned?
I think it's just a combination. We see people from all walks of life on a day-to-day basis. I think SAMHSA, which is the government branch for substance abuse and mental health, their guidelines and their demographics usually says it's middle-aged, blue-collar white males is the demographic is most opioid use disorder. And, with that demographic in my mind, I'm thinking that's some guy that's probably working in a factory, working construction, working a trade job probably gets hurt on the job, tweaks his back, knee, something, shoulder, goes to a doctor, gets pain medication, and becomes addicted. I mean, 10 years down the road, now we know how addictive, opiates are to the human body. And I think it just kind of revolves from that. Yes, is there the people who just one day tried it on the street with some friends? Absolutely. But the majority of people we see are working. They were just prescribed it after surgery, after, not in any malicious way, or a lot of it's from that original giving it out to help anything. We just now know it's that addictive.
Yeah. What are some of the more uncommon demographics that people might not know about that you've seen the opioid addiction crisis hit?
That's the common ones, and the blue collar middle class white male. And then, I mean, again, we see people from all walks of life. I do know, I was reading an article the other day, it was talking about rise in opiate use with the African American population, with trying to think all the other ones. I just know it was a big rise in the African American population, I think in the Hispanic population as well. And it's just trying to alter treatment courses and therapies. If does the kind of the treatment modalities we use now, does that still reach those new demographics coming up, or do we need to do more community-based versus doctor office-based? But to be honest, it affects anybody.
And with what's going on with the patients that you see, is it fentanyl? How is fentanyl making this worse? Is it people are dying? Is it people are getting addicted in a different type of way? What's actually happening?
All of the above. Like I said earlier, the people, when it all started and everybody was writing prescriptions, it's a double-edged sword, right? When they cut down the prescriptions, we're taking away the unsafe practices, the willy-nilly writing of controlled medicine just because someone asked for it or you feel it might be helpful. But we've put things in place that make sure the right medicine gets to the right person. That other side of that is it removed safe medication from the streets. It removed safe medication from people who were addicted. And now they're still trying to get their medicine or their drug of choice. And you can't just go buy an Oxy on the street anymore. You can't just go grab a Lortab or a Norco on the street anymore. You might think that's what you're buying, but it's some sort of pressed pill from somewhere that's more than likely not what you think it is. We're seeing a lot of fentanyl now. They're trying to dose out in their pill factories. And, fentanyl is a lot more potent than regular pain medication. It's 100 times, 1,000 times stronger in the same dose. So it's people who may not be chemist or someone that knows how to dose things out correctly. So that's a lot of times with all these deaths and the things like that, because we have trained professionals trying to dose out dangerous drugs. Then, we're handing out Narcan, and we're training first responders how to use Narcan, police officers how to use Narcan, firefighters how to use Narcan. But with, fentanyl and these new kind of designer drugs, the Narcan may work for a second. It may work not at all. And then it's, trying to get them into the emergency room. Then they end up on life support, and it's just a really vicious cycle. So it is making it harder for people, because it's in this world where we dose Suboxone and, try to dose it out according to what someone's usage was, try to keep them safe and try to keep their cravings in check. Fentanyl's a little bit harder to find that happy medium for them, because they're used to such a potent amount of medication in their system. Let's see, what else have we seen? And now we're seeing things that's fentanyl mixed with other things, and you just don't know.
Wow. What are some of the success stories that you've been able to witness with people that came in and they were really in bad shape, and you guys were able to get them on Suboxone or get them on something that was able to alleviate their addiction? Talk to us a little bit about what you've seen there.
Okay. There's been many times when we would have someone come, they'd finally reached the breaking point that it was, I have to get help. I've had folks come in that were homeless and come in, and we get them, on the right track, and we start working to get them resources. And now those same people, they may have graduated, or they may still come in and they have jobs. They have visitation right to their children now. They may have even gotten their children back, and you don't even recognize them from day one. I was talking to a patient the other day. I was like, I wish we had a photo of you,
Wow.
when you first came in. And he was like, yeah, I know that life is just totally different. So that's what we strive for, is to get someone back to being functional in their life, just enjoying their life and not completely driven by where their next kind of drug's going to come from.
Absolutely. So, you've been in it for a year and a half. You're very familiar with the history. You've seen quite a bit in the time you've been there. Where do you see this? So would you still call it a pandemic then, an opioid pandemic or epidemic? I'm sorry. Absolutely. Where do you see it going in the next 10 years? Are we going to have a better handle? Is it going to be a lot more of the same? Is it going to be a little worse? And we have to anticipate that? Like, where do you see things going?
I think looking back in 10 years, COVID really threw everybody for a loop, and usage of alcohol, of drugs, of any type of kind of substance increased during that. Rates of depression and anxiety and mental illness skyrocketed during that. And I think that just exponentially made the problem worse. However, with that being said, we've learned a lot over the past 2 years through the pandemic of how useful telehealth is. Mail order pharmacy systems, getting care and resources to someone's home. I think with the amount of kind of grant dollars that are coming out from the government and an actual huge push and focus on mental health right now, I think we're going in the right direction. Substance use is a mental health issue. Like I was saying earlier, it starts somewhere else because no one just goes and decides to use drugs one day. It may be a coping mechanism. It may be something else. And I think with all the things that have been put in place in the past 2 years, the big push on mental health treatment, and now they're, getting insurance companies to make sure that they're paying for mental health services. I know that's been a big thing in the news the past few weeks. I think it's going in the right direction. Will it be completely solved or fixed? I don't think so. I mean, if you look through the history of man, there's always been some sort of something that we as humans partake in to, I guess, get in a different state. Alcohol's been around since the dawn of time. Herbal things have been around forever, whether it be marijuana or peyote or mushrooms or what have you. I mean, there's always going to be something people take to alter their state of consciousness.
Absolutely.
But with the opioid pandemic itself, I'm pretty optimistic that with everything, we're going in the right direction.
Awesome. Would you say that marijuana has helped at all when it comes to opioid addiction?
I can't say for certain. Unfortunately, in South Carolina, it's still highly illegal in any way, shape, form, or fashion. But there is a lot of research coming out from other states that says it can help with certain aspects of addiction. We've known for years, with cancer patients in the study out west and cancer patients, it helps with their pain and whatnot. So if we can use cannabis to help with pain, then maybe that's an alternative to opiates.
Well, Zach, this was very enlightening today. You kind of gave us the whole scoop on what's really going on out there when it comes to opioid addiction. Again, you've only been in a year and a half. Is this a field that you plan to stay in for the long haul? Or where do you see you taking your career in 2 years?
I don't know. I'll probably be in it for as long as it's an issue. I really, enjoy the company I work for and everybody. I think we've built a fantastic team of like-minded individuals who just want to help their local community and then expand into other communities to provide the same service. I just like helping people. That's my thing. So will I be in substance use treatment for the rest of my career? Maybe, maybe not. I may get this everything going and this becomes a well-oiled machine, and then there's some other problem affecting the community that I was like, let's give it a try to get a solution out there for this issue. I don't know, but I see myself here for a while.
You're a good person, Zach. How can people find, for anyone listening that might know someone or might even have an issue themselves, how can they find you in your clinic?
We have a website. It's just medisic.com. The website has ways to email us, text us, call us, any form of communication. There's a way on our website. If they just need help, the government has changed the mental health hotline to now just be 988, just like, 911, just if anybody needs help with any type of mental issue, crisis, whatever, they dial 988 and they're directed to someone. SAMHSA is always a great resource. It's samhsa.com. Their website, you can type in your zip code and they can show you all the help in your area, treatment providers, counselors, all of that. They have tons of nice, very easily read help packets or information packets. I think the biggest help for someone in need is just proper education and not feeling stigmatized. Most people don't want help because they don't want to be labeled anything. Be an addict or a user or anything like that. It's, we found out that it's a disease. It's now listed as a disease. It's qualified as a disease. So you go to a doctor to help with it just like any other disease.
And last question I'll ask you, or not last question, but last question regarding the clinic. Do you guys see medical sales reps that come in and I'm assuming you have reps for Suboxone and other therapies to help people get off of opiates?
So shockingly enough, we do. The Suboxone reps are so hard to get in touch with.
Really? You guys are
Amongst
looking for them.
Yeah, because I've reached out to them a few times and was like, do you have discount vouchers or, sample vouchers or anything like that, to try your brand or this formulary or whatever. And they never come by. We had a Narcan rep come by once. I think they were trying to get the nasal spray out, and they had discount vouchers for local pharmacies to see if people like the nasal spray better than the shot. But most reps I see on a daily basis are lab reps wanting us to send them lab confirmations and
The testing. Yeah. And how's that interaction? Deal with them a lot? Is it pretty come and go? How is that working out?
I feel like they come in spurts. A few months ago, I feel like one called me every day, every other day, dropped in, and then it'll be a few months and you won't hear from anybody. I'm trying to think. But yeah, lab reps have been the biggest thing just for confirmation testing. Every once in a while I'll get emails or something from medical software, try our app. This app has been shown to help, our population health management software. Those are the kind of the big things we see.
Sure. For any of those listening that might want to explore being a rep in the testing space, any advice you'd share on how to best work with clinics like yours?
Find out who the decision maker is. Cold calls probably aren't the best, just with, like, as I was saying earlier, how a lot of the patients feel about privacy and things like that. So just, set up a meeting, schedule meetings. I always feel that gets to a decision maker a lot quicker. I was in sales for hospice for a while, and I get it. Like, I know what the life is like. And, when you got somebody yelling at you that you haven't hit a number and you're not close to a number, and get out there and go, I get it. This feels just a little bit different than the other ones, and I'm always willing to chat with someone. Everybody's got a solution to a problem, so you talk to everybody, see which solution best fits you and best fits the patients is what it's about.
Absolutely. And then you mentioned hospice sales. When were you in hospice sales?
Let's see, I can't remember. It was about 8 months. And then COVID hit, and the nurse in me was like, I can't be a telemarketer for hospice. I can't just call you and be like, hey, I know your mom's dying. Let me tell you about hospice.
Wow.
I was like, look, I'm a nurse. Y'all use me in other ways. If it's going to a home and I do the pitch there, but I'm a nurse and I can hold someone's hand, I can, be present going through this time in life, I'll do that. But I love sales. I think it's great. It's fun. In this role, before we got super big, I did a lot of, it's not really sales, but just community reach outs to other providers, just letting them know how ours worked. If they're having lots of calls of patients with certain needs, that we can take insurance. I went to a lot of the local behavioral health clinics and met with their decision makers. And it's like, look, if you guys are swamped and behind, we can take Medicaid. If you have people you need, you can send them to me and I will, get everything taken care of for them, just to take some of the load off of you guys. And then now we're doing a lot more community events, just community education.
Excellent. Well, Zach, it was wonderful spending time with you. We're going to have a little lightning round before we let you go today. And just answer it within 10 seconds, as soon as you can. First answer that comes to mind are typically best. Okay. So what is the best book you've read in the last 6 months?
The Change Agent.
The Change Agent. By who?
Yes, Damon West.
Nice. What's that one about?
So I actually saw him speak in a substance use seminar. He ended up in prison, and it's about how he turned his life around and now speaks and helps.
Wow, that is interesting. I'll have to check that one out. Okay, best movie or TV show you've seen in the last 6 months?
Movie or TV show in the last 6 months? I don't know.
I take it you're much more of a reader.
Yes, I read all the time. I have a toddler, so we watch a lot of Bluey. So
Fantastic. Fantastic. Best meal you've had in the last 6 months?
Since it's gotten cold, a nice big hot bowl of curry at the Thai restaurant.
Oh my gosh. Green curry, right? I'm a sucker for green curry. That's good stuff. All right. And then lastly, best experience you've had in the last 6 months?
Best experience last 6 months. Vacation with the family to the beach a couple of weeks ago. Now that the toddler is walking and talking and stuff, it's a little bit more fun.
Congratulations to that. That's awesome. Well, Zack, it was great spending time with you. Where can people find out more about you?
LinkedIn. I try to be pretty active on my LinkedIn. If people shoot me messages there, I'm quick to respond. I'm always in the community in the Greenville area. If someone else is local, like I said, we're really pushing community education and services here lately. So I'm trying to be out.
Well, thank you for the time, Zack. Keep on fighting the good fight and keeping our patients safe. And we look forward to hearing from you in the future.
Oh, absolutely. Thank you for having me. I really had fun.
Absolutely.
Have a great one.
You too. And that was Zack Cooper. It's a crazy world we're living in. And one thing I liked that he talked about was how the pandemic really taught them different ways they can get in front of managing this epidemic with the opiate crisis. And of course, all we can do is pray and hope that these pioneers continue to do the good work they're doing and continue to come up with better ways to help these patients and get them off of the drugs and get them to live a much cleaner and better life. One type of sales rep we talked about in this episode is testing sales. I've had a few guests on the show talk about what it's like to work in testing sales. And this is the kind of client you might have if you were to be a lab medical sales rep or a diagnostic medical sales rep. You might be actually seeing clinics like these and talking about what tests they should be using to really get in front of what's going on with these patients. So if that's something that interests you, then you already know what to do. Visit evolveyoursuccess.com, select Attain Medical Sales Role, and fill out the application and have a conversation with us about our program, the Medical Sales Career Builder. This program was literally designed to take professionals with bachelor's degrees and get them into medical sales roles, from pharmaceutical sales to medical device sales to diagnostic medical sales and testing. And if this is something that's been a passion of yours and you've been maybe banging your head up against the wall because you haven't been able to get in, you're not getting the interviews, you're not hearing back from anyone, or you're getting the interviews and you're not getting to that last round and you're out of options, you're maybe starting to think, maybe this is just not for me. Maybe I need to explore other avenues. Well, if you're listening to this right now, I'm here to tell you that is just false. It's because it's become so competitive that you now need to do something a little bit different and tap into a resource that clearly understands exactly how to help you present yourself as an outstanding candidate that any employer will take seriously and want to give a chance to and want to give the job to. We've helped over 1,000 people get positions. For the Medical Sales Career Builder alone, hundreds of people have gone through that program, that specific program, and we have a 90% success rate. So we know what we're doing here at Evolve Your Success, and we definitely want to help you. So don't leave your career to chance. Don't give up. Tap into a resource that can make the difference. As always, we do our best to bring you guests that are bringing innovation, trailblazing, pioneering, doing things differently in the medical sales space. So make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.